cannot see anything, you know, I cannot see the I don't know what happened.
Recording in progress.
Hi, good afternoon, everyone. We'll just get started in just a minute or so here.
Could you hear me now?
Yeah, we can hear you, Nina.
Okay.
All right, good afternoon, everyone. We're very excited to have this partnership today with the Central Virginia Legal Aid Society's Migrant Farmworkers program. You know, Carla had this nice idea a couple weeks ago. You know, we've had a lot of questions about migrant outreach that we've been kind of doing to migrant farm workers throughout Virginia, and to learn more about kind of the work that she's done, and then her colleagues at Central Virginia Legal Aid Society, the work that they've been doing for many, many years. First, I think at start, I'll turn it over to Carla. You know, Carla has been now, you know, working as a navigator with us since the beginning. You know, she joined us when she was at LHAC at the time and has been working as a navigator now at CVLAS in Richmond. But also, you know, before that, you may not know this, but she actually worked both at the UVA hospital and at CVLAS before that, kind of having a long history of doing outreach to migrant farm workers. And she just put in her note that this was before the use of GPS. So it was a lot more difficult traveling the back roads of Virginia using just the old-fashioned maps to find out. And I wonder how many times you got lost, Carla, doing that.
Yeah, that was all times very challenging. And you know, when I think about looking in the past, I think about, wow, it was amazing. It was hard work, and still it is hard work, but you know, we have different challenges now.
Well, thanks, Carla. Yes, I'll hand it over to you, and so you can maybe introduce your colleagues, and then you can start our presentation. And if people have questions or comments, like please, because we're doing this as a webinar, so we can record it for everyone. So just you can. I think that both the chat is open, so you know, please post your questions into the chat box, and we'll be able to see that there. And if you, you know, toward the end of the presentation, if we have enough time, we'll just raise your hand, and we can turn on your audio if you'd like to ask a question that way as well. So go ahead, Carla.
Thanks, Deepak. I just want to introduce my colleagues, Ninel and Christianne, and I have been working with them for the last 10 years in Central Virginia Legal Aid Society, and I'm going to turn it on to Christianne.
Good afternoon, everybody. My name is Christianne Queiroz. I am a Brazilian lawyer born in Rio de Janeiro, who graduated from University of Virginia Law School with a Master's of Laws a long time ago, more than I care to tell you. I am now the Virginia Farm Workers Program Director at Central Virginia Legal Aid Society. I know it's a mouthful, but you might be familiar because this is the same shop that houses Carla Torres and Eleanor Sullivan. I am here today to answer any questions you might have at the end of the presentation, but now my main task and honor today is to introduce my co-worker of 14 years and the Virginia Farmworkers Program Outreach Coordinator, Ninel Foss. Ninel is an attorney from La Paz, Bolivia, who has a postgraduate degree in public administration from Alcalá de Henares University and the National Institute of Public Administration in Madrid, Spain. Ninel has worked in Bolivia for the Ministry of Justice as legal assistant, for the Vice Ministry for Indigenous Peoples Matters, and for the Council for Administrative Appeals as legal advisor, where she was promoting the rights of Bolivia's indigenous people. Ninel relocated to the US in 2006 and is currently the longest serving outreach professional statewide, dedicated exclusively to promoting farm workers' legal education, empowerment, and the advancement of their legal rights, income, stability, and well-being in Virginia. I have heard that you are interested in learning about conducting outreach to migrant farm workers communities in Virginia, and there is no one I could recommend more than our own in-house expert, Ninel Foss.
Thank you so much. I don't know if you can see me now or I still without you can see me, but thank you so much, Carla, Deepak, and Christianne, to give me this opportunity to talk about the job that I do for this so long, and I will be happy to share all the tips that I learned in all this long way doing outreach. Central Virginia Legal Aid or the Virginia Farmworkers Program is a program of Central Virginia Legal Aid that is a non-profit law firm which provides free legal assistance to low-income people in civil cases and preventing legal education in our communities. Since 1971, CVLAS has advocated for those who cannot advocate for themselves. And the Virginia Farmworkers Program, a difference of our mother organization, is a statewide program because Central Virginia Legal Aid serves the areas of the city of Richmond, Charlottesville, and Petersburg, and surrounding areas only, but as are a statewide program. The Virginia farm workers serve farm workers that work in the agriculture. And there are, according to the US Census of Agricultural 2017, there are the estimated number of farm workers are 2.4 million farm workers. And there are over 50,000 in Virginia. And every year, the average workers that we reach are 3,000 farm workers. We also serve US citizens and residents that work in agriculture, and guest workers that come to work in the agriculture with a type of visa H2H, that is for agricultural workers. Most of our clients are Mexicans, Jamaicans, and people that come from Haiti. We have some Guatemalans also, Salvadorians are very little, and also since few years ago, there are also Colombians. But most of the people, most of our clients are Mexicans. There are 317,619 H2H positions certified by the Department of Labor for 2021 in all United States. And I think the number for Virginia are around 5,000 farm workers that come as a guest worker with a visa H-2H. The other slide, please. As you can see the picture, those are our clients. She's a woman from Haiti that works in the Eastern Shore, and some workers that work in Rocky Mount on the right. And here is a worker that used to work in Dry Fork, and he got COVID last year. You can pass, please, the other slide. The way that we organize our outreach every year is from February to November. This is all the time that we do outreach. But from February to March, we do outreach and visit camps are civil and surrounding areas. That the crops are grapes and apples. But I think probably we have to update a little that, but also, of course, hire more people to work with that, because I see that there are more clearance orders for around all the state of Virginia that are more vineyards where are hiring H-2H workers. From April to May, we cover Richmond and surrounding areas, South Side, Virginia Beach, and the crops are vegetables and tobacco. From June, July, and August, we cover the south side area of Virginia, Eastern Shore, Northeast, and the crops are tobacco, tomatoes, and veggies. And from September to October, we cover the south side of Virginia also, and Winchester area. We keep with tobacco and apples. Tobacco workers are hundreds of workers and are like a little places where you have to go and try to reach them. And I think it's the more difficult part of the job. They are very isolated. They don't get not too many people that go to visit them, you know. And but it's, I think, the part that I like the most, you know, help to the tobacco workers. In November, we keep going to the tobacco area and also go to the Southwest Virginia to visit workers that are working there in the pine trees. And the other slide, please. As you see in this map, we visit every year around 40 counties in Virginia, where all the workers or all growers that hire H-2H workers, we go and visit them. And probably in the new clearance orders from this year, there are more camps that use farm workers in other counties that we don't cover, you know. Then probably the number of counties that we have to visit this year and in the future is growing. You can see here there is like the seasonal jobs that go. This is where we go to reach the workers. We look for the like I put agricultural workers or H-2H workers that work in Virginia, and you start getting the clearance orders, and you can see in the clearance orders the name of the farm, and you can see how many workers they are hiring this year. You see the how long will be the season. Like some of the workers, like the apple workers around Charlottesville area, they start working in February and they end working almost like November or December. Those are the workers that have the longest time in the longest season. They are here in United States more than 10 months. It's like they live more in United States than in Mexico. The other slide, please. What we do, the Farm Workers Program educate workers on their employment rights, workers' compensation. We give information about taxes, but now it's like they have a lot of taxes problem. So we only provide the number, and we try to refer to somebody that do free taxes and can help in their needs. We used to help with the Affordable Care Act when there were no navigators, and when the Affordable Care Act started, we used to give the information to the farm workers about that, and if they would like to register for that program. And after when Carla started and Amelia was called, we were doing outreach with Amelia for a long time, and also referring workers to the navigators, the workers that were interested. But later we start covering more or get more busy with all the workers' compensation cases and all the employment rights. Then we try to focus more on that. And in our grants that we got last year that help us to hire part-time students to help with the program and with the outreach. So we dedicate more time to distribute information about COVID on the time of COVID. We were one of the few organizations in the nation that keep doing outreach during the pandemic, and in-person outreach, I mean. We also help like with workers' compensation, and we are the only program in Virginia that help with workers' compensation, and Christianne is doing a really great job on that, on help these farm workers, because if we cannot help these farm workers in their workers' compensation cases, there are not attorneys that are interested in take this because they are not a big cases, and also many of the law firms don't have people that speak Spanish, or they cannot contact the workers when they are in Mexico. But our program, we are in contact with them when they are in Mexico, and when they are here, and when they leave, we keep in contact with them. We provide legal advice in workers' compensation, legal representation, attorney referrals also if there are workers that we cannot serve. We help with the claim for the benefits forms, also provide help to get medical records and negotiate settlements. Help with their medical bills, because sometimes they have to go to the doctor and like they have like some problem that is not covered for workers' compensation because it is a health problem. So they go to a clinic or to a hospital and they don't have the money to pay for this, and we help with the forgiveness of the bill, or try to make they pay a little less, because they don't really have too much, and there are some workers that only come for a few months, and we try to help them with that, and also with the grants that we were having these 2 years for food or medical stuff. We were helping in medical bills to many farm workers. We also help with restoration of wages, reimbursements, and other employment issues. But our focus is more the employment rights, and this is our focus. But we also, because we are almost the only program that is there twice a week from very long time, from February to November, so we try to give some information to them, and I am the person that is traveling the whole time. The other slide, please. Last year and the year before that, we got 2 grants, the migrant grant and the migrant grant, that is our grant, the migrant relief grant, and the grant from National Center for Farm Workers Health and the CDC permit us to hire seasonal students. So they help us to do more outreach, and we reach around 5,000. We reach 5,196 farm workers. But the program drove more than 15,000 miles to be able to visit 161 workers' houses. The other slide, please. How to conduct a successful outreach? First, you have to plan your outreach and find the area where you are going. Like if you are going to Pennsylvania County, you have to go and look the clearance orders for VAGA, that is the Virginia Grower Association. And so the clearance orders for Pennsylvania County are there because it's tobacco workers. So you go there and you look for the county Pennsylvania, and you can see all the camps that are in that area. You can plan to go to 3 to 5 places that are close each other. Before, we used to organize that in a Google map and go like from the farther to the closer one, and go like to the A, B, C, D, and we used to have the directions in the reports. So because when I started, we didn't have GPS or anything like that. We have maps, you know, and we have in our reports, we have the directions, like go to the right in this one, go to the left in Tobacco Lane, go to left in I don't know, Owen, or many other routes, you know, that are always over there in tobacco places. But we used to have that, and that was a good thing, you know, because now that I use GPS in the phone, I use the phone for directions, but sometimes we don't have signal, and we are like, oh my God, where I am? You know, if you don't have signal, you don't know where you are, and you don't know how to get out from that place. And that is always good to have also a GPS and also a map, so you can look where you are, and you don't get lost because you don't have technology, or you lost your signal. We used to plan, or we used to go to 12 places to visit 12 camps every visit, but it was too much, I think. But we started like 2 or 3 in the afternoon. We leave at 2, and we were there in the different areas. Like if they were far, we were like at 5, and we start visiting, but not many workers are at 5 at home, because they in summer season, they end to work sometimes 6, 7, 8, sometimes 10 in the night. But we try to, if we are in the area, we go and we leave our information for them. So if we don't reach them, but at least they have our information, and if they have an emergency or they need our help, they can call us. So in the second or third camp, you find some workers, and you start talking, and sometimes they have so many problems and so many questions that you cannot go to more camps, because you are talking and talking and talking with them until it get dark and you have to go, you know. But I think mostly 5 places is a good number to do outreach at night, and do a good outreach. Also bring all your documents, because sometimes I don't bring some documents, and I need that, you know. Then you always, before to do outreach, you organize everything to go to outreach. You can bring also a letter to live in the house of the workers, telling who you are, why you are there, and tell them that they can call you. This is what we used to do. The other slide, please. Okay. Some tips to be safe in outreach. Always before to leave, you send an email or message to your boss or to somebody else in your office, or your husband or your daughter, or your telling them where are you going, you know, what is the area that you're going. Drive safe. It's better to work in pairs, but that is not always possible. Like for many years, I was traveling by myself, but most of the time. But I think probably it's better to work in pairs. Buy gas before it gets dark, because it happened to me that I was looking in the GPS gas station, and they send you to gas station, and there are like abandoned gas station in some areas, you know. Then it's better to fill your tank before to start your outreach. What more? Have a map of the countries, the thing that I was telling you before. Bring GPS, bring round trip directions. Even still, if you have phones now or more technology, you can lose signal. Then it's always good to have probably print your directions. Lock the car's doors and leave the camp if threatened. That is not because the workers, they are nice, but sometimes but I think probably if you go to do like, no, sometimes I don't know, if you do more things like health, I think it's easier, because the thing is, when you say to the grower, I am here to give information about employment rights, they don't like too much that, you know. But if you go there to give information about health, I don't think that they will have any issue. You also can ask for permission to go there, but I don't ask permission, because the workers have the right to receive people to go to visit them. Okay, the other slide, please. We were one of the first programs in use social media. We are using Facebook since 2017, and also WhatsApp. I was using WhatsApp to contact workers in Mexico, and for them to send me documents. And of course, in all the time of the pandemic, we started using more and more, you know, and now we have not only Facebook, we have 3 Facebook pages, we have groups in WhatsApp, we also have Instagram page, and we are also trying to improve those every time more. To the other slide, please. I would like to show you how does an ordinary audit day for the Virginia Farmworks program look like. If you can press the video, please. Well, I cannot hear music there, but okay, but mostly you can see this is, you are driving and you go and you see signs that say don't go here. I remember that I did outreach one time with the executive director of my organization. And when he saw that sign, he said, no, you don't go. I say, no, I need to go, because if I don't go, I don't do my job, you know. I need to go inside. And after that, you go to the camp and you knock the door, or sometimes the workers are outside eating or playing something, and or chatting, or they are in the phones. Then you go knock the door, and I always say, ask them, can we visit you for a few minutes, please? And I would like to give you information about your rights, about I don't know, about COVID. I would like to donate this, and they are always nice, and they say yes, of course, and you give them the information, and I start talking about their rights. I start talking about everything, and I also, when I talk about workers' compensation, I tell them stories about some clients that we had in the past. Of course, I don't say the names, but I tell us what happened. Like sometimes, like a farm worker lost a piece of finger, you know, and he was ready to lose his rights, because he lost the rights after 2 years. But I was looking for him in every place. I was telling who knows that person that will lose his rights, workers' compensation rights, if he doesn't reach us. And I think a month before he lost his workers' compensation right, he called us, and we were able to help him. And the other slide, please. But that inspired, I think, or give the opportunity for the other workers to say, oh, I have this, you know, or they said, oh, I have that. So I always tell them stories, they can, or they can do something about their problems. I think this is the last one. Yes, I think you can contact in this. Those are the CVLAS.org is the website of the Central Virginia Legal Aid Society. This is our Facebook page and Instagram, and we also have the Gmail account that you can email us, or to our personal, or to our WhatsApp number, or the phone number that we have that is in the last page of this presentation. And I don't know if you have questions, and also if Christianne would like to add something to this presentation, she's welcome.
Thank you very much, Ninel. I think we'll wait for I think Carla has a lot to say, so let's save questions. Let's save time for questions. I've been active in the chat, answering some questions, making some clarifications. And I warn you, they have asked your email. Thank you.
All right, I'm back. Where I'm talking a little bit in general lines about what options do we have for farm workers. And one of the options that we have is Medicaid. And what we're going to see is LPRs in Virginia, and they're spread all over the state. And the ones who are going to be eligible for Medicaid will be the ones who have been permanent residents over 5 years. And the income eligibility, it varies depending on the household side and the program. So I have included this link here so you can check every program and the income levels. We're also going to see some US citizens in the state, not many of these two above, but they're in different gaps. And most of the camps that we've seen with US citizens, they will be eligible for Medicaid because of their income. And there are different camps with potato workers in the Eastern Shore. There are other statuses that will be also eligible, like other humanitarian statuses, like refugees, asylees, and Haitian entrants. Pregnant people of any status will be eligible for Medicaid, including undocumented workers. And we also have emergency Medicaid for workers with no status. And also, of course, they can use the clinics, the free clinics. Can you pass the slide, Deepa? Another option would be marketplace. And of course, we're gonna find like the H2A workers, the agricultural workers, and this is the main focus for the migrant program at CVLAS. And as we know, these individuals, because they're barred from Medicaid by immigration status, they will qualify for the marketplace with zero income. We can also see H2B workers, that they're non-agricultural workers. These are, for instance, like workers who work in the landscape, but they don't typically live in labor camps or trailers. And actually, they're really hard to find. And we're also gonna see some lawful permanent residents under 5 years. And under 5 years, they will be eligible for the marketplace, okay? And with no income, they will be eligible. As you know, all these workers, they have the tax filing requirements for APTCs if they're gonna get marketplace health plan. We're gonna find also some citizens that they're over Medicaid income limits. And this is a little tricky because we really need to estimate how many months they're gonna work, how many hours they're gonna work, but we know that all these workers, they're gonna find a place to go as far as healthcare. They're gonna be eligible for either Medicaid or the marketplace. Another requirement for the marketplace that all the navigators know is that they need to find jointly if they're gonna get premium tax credits. This is a little challenging for the farm workers, but you know that that's a requirement. And next slide, please. So speaking about the marketplace, you know that open enrollment for the marketplace typically is November 1st until December 15, although last year it was extended until January 15. For the workers who arrive to Virginia, they're going to have 2 months of special enrollment period as soon as they arrive. So you can always sign them up during those 2 months. But this year we have a new special enrollment period for individuals who are under 150% of federal poverty level, and they're not eligible for Medicaid. So that means that we're basically gonna be able to sign them up the whole year. And likely they will be eligible for cost share reductions, which means that special price for deductibles and really reduced prices for copays, and if they sign up for a silver plan. And then we know that if they offer health insurance with their job, we know that they will not be eligible to sign up for marketplace. And there also there's an exception for that, but I haven't seen, like, since I've been working with the farm workers, I haven't seen that exception, because it has to meet that the income for the household has to be over 9.61 of the household income, the health plan, I'm sorry. So I haven't seen that so far. Next slide, please. Just a few enrollment tips. As I say, they have 60 days to sign up. I don't feel this year is going to be an issue as far as signing up for the whole year. Something very important is that they need to cancel the plan for the marketplace or Medicaid before they leave Virginia. Okay, that is something that we need to really include in our education. We need to reiterate the tax filing requirement. because the farm workers legally they're obliged to file taxes, but many of them they don't. Again, the married individuals, they must file joint taxes to get APTCs. And for some farm workers, actually, they make as little as $15,292 annually. And that means that adding health costs is super expensive for them. So they really think about it when they need to add another expense to their salary. And we need to do a lot of education on why it's so important to have healthcare. Next slide, please. I'm gonna talk a little bit about some enrollment tips that it might be helpful for navigators this year. The enrollment, as you know, it can be done like in the camp, or it can be done over the phone. We have learned this year and the last 2 years we've learned how to do enrollments remotely, and this is going to apply to the farm workers the same. We can get the consent even verbally now, and then just do the application. On the immigration drop-down menu, they haven't included all the immigration statuses, but you can click other. So the H-2A is not included there, or H-2Bs, but then you can click other and then enter all the visa details, like with the citizens and the LPRs, you will not have any problem. I did make some distinctions with the visas, and it's because we have two big migrant programs in Virginia. One is the migrant program that we're doing the presentation today with CVLAS, Ninel, and Christianne, and they've been doing this forever, but we also have LAJC migrant program, and they visit other camps, the camps that they can represent, and those are different visas than the ones that I have mentioned today. You might see also H-1B visa with the oyster workers, and they're also eligible for the marketplace. We need to anticipate with enrollment that most farm workers, they're going to get DMI, that's a data matching issue, and that means that they're going to be requested for more documentation. And this is because they either haven't filed taxes and there's some discrepancies in the systems, or because they're immigrants and they always have to check their immigration status. But this year it seems like it's been really easy to upload the documents. For some reason, they don't need to come to the office. They can just text you the documents, and you can easily upload them into the system the same way as if you were working with another immigrant. Another slide, please. Okay, and this is, to me, I would think that this is the most important slide for our presentation, for my presentation, is why it's so necessary to reach out to this population. And this is because they're really unaware of their own eligibility. They don't even think that they can be eligible for healthcare. And I feel that we have that obligation to bring those resources to them. And there are some things here is like the lack of knowledge that that we have in the US healthcare system, and the knowledge that they have is in their culture is really different. Like many of the people that we met, they don't have healthcare in their own country. So they're used to, when they go to the doctor, they just pay for it, and they pay a very small fee. So now to have to pay health insurance is a little unthinkable. But something very important is that they don't know that they might end up with a lot of bills if they don't have health insurance. So many of them, they're used to, I'm going to save this copay monthly, and I'm just going to a free clinic. So it's really important to have education, even though if they don't want to sign up, just to go there and see what other resources they need and explain about how our system is, our health system. Otherwise, you know, they come here to feed their family for the whole year, and they might end up having astronomical bills. And I feel that it's very important that we let them know that that could happen. Also, they have a very unique health challenges. Like, for instance, I feel that, you know, they work so hard that for me, this is the most vulnerable population that I've seen. And I have been working as a navigator since the law passed, since the ACA passed in 2013. So, and prior to that, I work with this migrant program. So I've seen what's going on. And also I work with the migrant program in LAJC. And from all the populations that I have worked as a navigator, like, you know, DV individuals and incarcerated people, Hispanic population, we touch all the segments as navigators. I feel that this population is the most vulnerable because of their isolation. They leave, they just basically come here to work, and they're really tough. They work 12 hours, you know, under really extreme conditions. So they tend to get diabetes. They tend to get kidney stones because many of them, they don't drink water. And they bear all this without going to the doctor. And then one day, you know, they put up with all these situations, and then they end up in the emergency room. And because they end up in the emergency room, they're gonna have like astronomical bill. And I think that education is part of what is the most important thing here. Next slide, please. Some special considerations. I think I already said that it's very important to likely do 2 visits and educational visits. One, you're going to determine what they need. You're going to explain what is a copay and what do they qualify. They can qualify for Medicaid or Marketplace and all this. And they're going to have the free clinics. And the second visit, you can gather all the paperwork for a possible enrollment. And it's also important to adjust your time as needed, because some camps in Virginia, they're really humongous. They're super huge. And if you're not going with a good team, you know, basically they're so big that you're just going to give pamphlets. So it's good to prepare ahead. Now, another issue is the taxes. That's a little complicated. And this is why we have a tax expert within our navigators. Dan is around. So the farm workers is if they meet the definition of resident aliens, and I'm not talking about permanent residents, I'm talking about resident aliens under the IRS tax codes, they must file taxes. So we always advise that, you know, it's in their best interest to file taxes generally, especially if they're going to sign up for the marketplace. The pay stubs is good for the navigators to know that the pay stubs look very different because they're not subject to certain deductions such as FICA or Medicare. The H-2A workers with family members in Mexico or Canada, they might be able to include the dependents while calculating household size for the marketplace application, and they need to apply for ITs. And that will be another conversation. If we have another discussion about farm workers, we can talk about all that. Next slide, please. How we can raise awareness, and I think you have a really good idea on how you can raise awareness. Of course, social media, this is a big thing today. Now, we didn't have that back in the day, like when I was an outreach paralegal. Like Ninel says, you will get the directions, turn right on that tall tree. And that was what we're doing. And now basically, you know, you can just do a lot of things with WhatsApp. We communicate with our clients with WhatsApp. You can forward this presentation. We can do more presentations about outreach or farm work or taxes or any interest that you have. I think that is very important, like as navigators or health providers or member of any organization, is to know what you have around you, to be able to refer people and to be able to provide the resources. Like for instance, I'm a navigator and my focus is healthcare. However, I like to know, talking about farm workers, what camps do we have around this area? We have Mechanicsville, we have Dinwiddie. It's good to know like what's around, because if they need anything like these farm workers, you know, I can refer them to the clinics here, or I can refer them to a church that they can provide food or any other resources. So partner with clinics, partner with churches and organizations who do this type of work. There are meetings like along the year that their focus is migrant work, like the council meeting, and they have like LAJC and our migrant program, they do some events together. So, you know, you can ask if they need any help with events. You can find out where the farm workers go. I know that they love to go to Walmart on Sundays, and you know they attend specific events. And Ninel and Christianne, they're the experts in knowing what's going on basically in the whole state. But as a navigator, at least you can know what's in your area. The RAM clinics. The RAM clinics, they're just, I think that is a wonderful, they're wonderful clinics. And, you know, there was one just recently in the Chesapeake. So find out where they are in your area so you can help doing that. Next slide, please. Oh, okay. I thought that there was more, but we're open to continue this conversation. And if you have any questions, I'd like to know, like, if we have more people in this group interested in learning what to do, or what, you know, if we want to learn more about doing outreach, or what is that they need, or healthcare in the labor camps, we can continue another discussion which is more interactive, and then we can hear from you what's going on in your area or how you can offer your help. So if you have any questions, please feel free to talk now, or you can just email us. I think there's another slide with our contact information. And also I want to send that, I meant to do that, I want to send the information for the other LAJC program, because they also do a lot of outreach. And also Enroll Virginia, we have been doing amazing flyers for farm workers, and with general information with our phone number. We have a 1-800 number that they can call, and it will be directed to the navigator in that area. And I'm not sure if Amber has brought these flyers today, but we can show you the flyers in our next meeting in the listserv. If you have any questions, feel free to ask now. Richard, in order to apply for plans, there is to be able to identify jointly if they're married. So to apply for the marketplace, yeah, there is a requirement to file taxes for anybody, for farm workers, for anybody. There is a requirement to file taxes. And for them specifically, they need to apply for an IT number because they don't have Social Security, and the IT number, they have to request it. And this is a little complicated. And then they might require it and they might not get it until the other year. but yes, they have to file for the IT. I'm not sure that there are other legal requirements, but to have like your address, your name, and your visa, and to file taxes for the IT. Yeah, Dan is answering that question. Thanks, Dan.
Most of the workers have a social security, but is for only work in the agriculture, and also they can only file with their wives. They cannot include, since 2017 or 18, they cannot include their children if they are living in Mexico. And I think I saw that this is kind of different from the Affordable Care Act, yes, because you can put in the application the children, yeah, if they are in Mexico. But I think for taxes, it changed, and you cannot file as a dependence to your children if they are in Mexico.
Let me see. I think Amber is showing the flyer, Deepak. Yeah, Dan can probably explain better, or we can have this conversation if it's too long because of this substantial presence and all that. Then we didn't want to get into that. But yeah, they need an IT and they need to file taxes. That's totally the main message. And as far as the ACA, they will need to include all the members of the household. But
Thanks. Yeah, I think you had, we talked about it in the presentation, that I think some things like taxes and things like that, you know,
yeah.
to kind of consult with experts who are on those different issues. And
right.
you know, I think, you know, as you're kind of planning to do outreach, or particularly the navigators and CACs, do coordinate that obviously with Carla at CVLAS. We've also got Ruth at Legal Aid Justice, who's helping do a lot of the outreach at that program. And then internally, we've got Dan and Amber to help as well. So, just reach out and we can help kind of figure out, and if there's complicated ones as well, kind of get them qualified tax assistance to some of the clients you're helping with.
And one point that I believe that Carla mentioned, but it's not ever enough to emphasize that filing taxes for H-2A farm workers, for the visa guest workers who work in agriculture, is really a tremendous issue here in Virginia. So getting adequate help in filing taxes, it's quite complicated. A lot of workers end up with tax liability and then have to get help to resolve those issues. So this is really, I mean, if we could have a way of, and this is just as a suggestion, out of the blue suggestion. I don't know if your team of navigators could, I know you have Dan, but one person is not enough to serve thousands of farm workers individually. So if we could have established some sort of partnership with tax preparers, I think it will be more viable, the enrollment of folks who are visa guest workers.
So yes, this is an issue that Carla and I discussed this morning, and it's beyond what we can cover here. Very rarely are you going to find a tax preparer that is a volunteer that's going to be competent in this area. We have to develop that set of skills. And I think that Carla has a couple of really good ideas for doing that. One of the things that we need to provide the workers is the information about what they will need to do in order to properly file if they have a filing requirement. So again, not everyone will have a filing requirement, but some will. And we want to make sure for a number of reasons. And one of them is something that Carla and I discussed this morning. If they ever want to change their status, they need to have a good record of adhering to the IRS rules.
Right.
Thank you so much, Dan. And I also just noticed, yeah, thank you so much, Amber, for doing that. So Amber just sent out a flyer that is available specifically for healthcare information for farm workers. So it kind of gives a high level in both English and Spanish information about marketplace, but H2A workers and how to get tax credits, and then the phone number to the 888 number that people can call, and that'll connect them to their local navigator on there. So thanks for doing that. And we have the capability to, for some of our partners that might be on the call as well, we can adjust these flyers and things like that to make differences with the contact information and things like that, just to kind of coincide with the type of outreach that you are working on specifically. So happy to make adjustments and kind of use even creativity to put it on, other types of materials, if that makes sense.
I actually think, Deepak, that if those flyers could contain, and I don't know, this is a question for Dan, could contain tax information, they will be much more well received, so to speak,
Yeah.
and read by farm workers because they are highly interested in information regarding taxes.
Okay, that's good. Great. Thanks. That's a great point. Yeah. Let's
Yeah. In fact, Christianne, and this hit me afterward, and again, this is something else Carla and I talked about earlier, is we also want to make sure that we protect them against unscrupulous tax preparers. Because we
many
don't,
out there. Yeah.
yes, there are more than we can count. And unfortunately, this may be the best way to start stopping the thievery that is occurring.
Yeah, I think that maybe, Chris, I don't know if you remember when we had that wonderful training with Bob Wendili, that his main focus is workers, farm workers, and he gave us like a really excellent presentation. Maybe we can bring him and get more educated about that, so we can tell them what to do. That was just another idea.
Yeah, I want to just give just a time check. I know we've gone over just a few minutes here, and I want to just first take a minute to just thank Carla, Christianne, and Ninel for a wonderful presentation today. And it's been really helpful to learn more about this and kind of how our team can connect with your team a lot better, and also with LAJC's program as well, because it's such an important issue. I just want to see, it looks like there was just one question I think I missed. It had come in through the Q&A chat box. I'll just read it off. We can just do it quickly before we sign off. Yeah, go ahead.
Sorry, there is a question that I just saw, and it says, I am wondering, when you do outreach, do the farm workers ever have other legal questions that are not healthcare related? If so, what kind of concerns or questions do they tend to have? What other needs do they have? I think, because they have a lot of questions about taxes, about workers' compensation, that is that we can serve them, and other employment problems also. And of course, I always write down the name. If I don't know the answer, I write the name and the phone number, and after Christiane call them back, or I refer them to the person that or the organization that they can help them. Like, this is what I do with taxes, and yes, there is a big need from not only to give the information or to help them to file taxes, but solve their problems and yeah, and try that like bad people don't do bad things to them, you know, because I hear many people from like North Carolina come and they are, I think, Latinos also, you know, that go and do their taxes and ask for the passports, and they took the passports and they never returned to them, you know. And I saw that many things like that happen.
If I may, real quick, because I think we are already over time, but just to also mention some of the concerns. So discrimination, retaliation, wage thefts, not paid working hours, right? Working conditions, abuse or hostile work environment, field sanitation. So whether there are toilets and whether breaks are legally available to them or not. So we have several questions of legal nature, criminal nature. I mean, you name it. We have questions on all sorts of areas, not only just legal, but consumer issues. So we have all sorts of concerns of the workers, because we have been doing this for a long time. The workers bring up to us, and we try to, refer them to the correct professional that might help them, if it's not the case that we can help them with.
Yeah, and adding to that, Chris, like having a really good resource guide, like for each area, I think that would be like so useful. I know you're gonna talk about that in the Migrant Council, to ask them to put one up. I've seen one in the area for the Eastern Shore, but it would be great to have like with different areas, like all kind of resources, so we can give them that resource guide for referrals.
That's great. Thank you so much, Chris, and Carla. And I will, as I think I put it in the chat, we did record this webinar, and we also will be sharing the slides out. So, but thank you everyone for joining us today.
Thank you, everyone. Appreciate your attention.
Thank you.
Thank you.
Thanks, Deepak.
Thank you, Carla.